I'm Greg Allen. I'm a retired doctor in family medicine. And in the 80s, I began to specialize in HIV medicine. That's just because my patients required that. And I took it as the main part of my career, actually. I actually ended up in the residency program at Group Health in Seattle. I love the philosophy and decided I'd apply there. The doctors are salaried. They don't make more money if they do more tests or refer more. So you can take care of people in a way that you feel is the most appropriate. I love having no financial incentive to do things that didn't need to be done. I thought it was a lot more pure medicine. And the fact that people could get sick and their coverage was the same. They would be covered. So it was a wonderful idea. Somebody that had moved from San Francisco and joined my practice, and I was taking care of him, and he got sick. He got high fevers and a number of symptoms that were really bizarre, and went from being totally healthy to dying within a month. He developed this kind of incredibly aggressive non-Hodgkin's lymphoma that took over and just didn't respond to anything we did. We had to biopsy it to prove it, but he died really, really rapidly. So, and at that time, I mean, we couldn't test for anything. Non-Hodgkin's lymphoma wasn't added to the criteria for AIDS for probably 6 years, I think, after that. So the challenge was enormous. It just made me feel like we had to be on our toes all the time, paying attention to possibilities that you would never think. The weird malignancies in the brain. There are malignancies in the body cavities that would be totally unlike anything else and act bizarre with symptoms of bloating suddenly. They were not visible on imaging studies, but they would have tumor cells line the cavities of the belly or in the lung and produce fluid. So you just see the fluid as manifestation, but you couldn't find masses on CAT scanning or things like that. The infectious disease doctor and I were on the phone call all the time talking about cases because it was all weird infections that were popping up. I had people who joined my practice that had moved like from New York to Seattle because they couldn't walk down the street without having painful memories of all the people, friends they'd lost on that street. So that they just had to get away. It was the only escape they had. So it was a horribly bad time, and it was fairly impotent. We were not able to do much. We could treat some infections, but they would come back, and we were basically entrenched with, here's one medicine, AZT. We give it in huge doses. You have to transfuse everybody, and they get sicker than dogs, and they were not saving lives. So, we started to get more drugs out, but we really didn't have a clue as to how to use them. So, I think the hardest was for people with Kaposi's, because it was kind of like a neon sign. It was almost always in spots on the face. Wasn't a time when we were wearing masks, so you couldn't hide it. And so I think them walking down the street, they were labeled as HIV positive and AIDS because of those skin lesions. But there were also all the people that were wasting, just getting thinner and thinner and thinner. And at that time, the thoughts always were that if somebody's wasting away, it's not cancer, it's probably HIV. Um, it was very, very hard for people. I think people felt a lot more isolated, and people abandoned friends sometimes. But it was hard to find where they could fit and not be alone, I think. Since I was specializing in HIV medicine, I actually joined the residency faculty and set up an HIV clinic through the residency with my nurse and a social worker. Um, and then we later recruited a pharmacist who became specialists in HIV. And so we would train the new doctors and expose them to my patients that were willing to come to the HIV clinic to be seen there for their follow-up. Before I had children, my obstetrics patients would kind of not quite relate to me, say, as parenting, skills. And I tell them what they should do and how they should work this. And it's not that anything I said before I had children or after was different. It's just that I had the respect of somebody that was now a parent. Um, I think that must have been true for a lot of gay men in my practice, that it was hard for them to feel comfortable that I'm not gay, but yet I'm pretty open to talking to people and listening, and I felt at the time like it didn't make a difference, but it clearly would have in hindsight with maturity and thinking. I had enough patience that we saw the breadth of what HIV could do, and some people seemed to do really well with it. So, but the majority of people really felt like it was a death sentence for them. And early on, that was pretty much true for the majority. It's hard to imagine, but it was like I said, surprisingly positive. It felt good to be there for those people to try to help them through that time. I had a physician in my clinic that had a HIV patient who was in Bailey-Boucher, expected to die, and he was leaving to go to Bellingham in practice, and so he was going to pass that patient on to me. So after work one night, we drove to Bailey-Boucher and saw this patient, and he said, well, he's got CMV retinitis, so he's near blind. He's in renal failure from the drugs for the CMV retinitis. He's got pneumocystis. He's really not expected to live more than a few weeks. And we walked in, and he said, hey, nice to meet you. I'm going to go home next week. I'm feeling great. It was pretty amazing to see. And he was my patient for as long as I practiced. He got out of Bailey. The medicines turned him around in a month and a half. Everything started to reverse except for the blindness and the renal failure. So, yeah, people stopped dying for the most part. It was just miraculous. It was amazing to give people hope that much, that they could basically live a life and not feel like they're going to die. The person that got out of Bailey went back and got some credentials and went into one field, then they went back to college and got another set of credentials and changed careers a couple times. It was amazing. The amount of knowledge that came out of HIV was enormous, and absolutely enormous. The number of tumors that are caused by other viruses when you're immune compromised, that before HIV were also killing people, some young people, some brain lymphomas and things like that. Being able to help people is the positive thing. That's the thing that kept me going strong, really.